Okay. Well, we're upwards of 400 and climbing, so I think I'll get started. Thank you everyone for joining us this afternoon or this morning, depending on where you're tuning in from. Welcome to the National Community-Based Violence Intervention and Prevention Initiative Resource and Field Support Center. Webinar titled Person, Place, and Thing, Understanding the Context of Community Violence. Throughout today's webinar, helpful links will be provided in the chat box. Please submit any questions you may have in the Q&A box found at the base of your Zoom screen, and we'll do our best to address them live on this webinar or privately in your question prompt. If you have any lingering questions at the conclusion of this presentation, feel free to submit a TTA request to our National CVIPI Field and Support Center TTA portal at the link shared in the chat. This webinar will be recorded and will be available online afterwards. Captions are available and can be turned on and off using the menu at the base of your screen. Please contribute to this conversation via social media using the hashtag CVI Strengthening Communities. And please feel free to introduce yourself in the chat with your name, organization, and location. For today's agenda, before we engage with our distinguished panelists, I want to set the stage for what's ahead. First, we'll provide a quick reminder on how to access resources and support through the National CVIPI Resource and Field Support Center. Then we'll take a few moments to reflect on last month's webinar, which addressed foundational elements of CVIPI and described what sets this work apart from other safety strategies being deployed across the country. For those that have not yet seen our initial webinar, Catalyst for Change, Approaches to CVIPI, we'll also drop that link in the chat. After that quick reflection, we'll leverage the CVIPI checklist tool to help define the intentionality of this work, with its narrow scope focusing on those specific people and places that drive community violence. We'll then bring in our panel to share how CVI efforts in Newark have evolved over the past decade and the process steps, including data collection and analysis, that they use to determine how to prioritize CVI resources allocations, both financial and personnel related, to ensure those resources are engaging the right people and places driving community violence. After the panel concludes, I'll provide a quick summary of the discussion before leaving some time to address your questions. So before we get into our topical discussion, and for those that may have missed the first webinar, our LISC Safety and Justice team is humbled and grateful to have had the opportunity to collaborate with OJP and some amazing CVI partners in the development of the National CVIPI Resource and Field Support Center. Over the next several months, we'll be building out the webpage by highlighting CVI programs from across the country, adding CVI resources and tools to inform program planning and implementation, sharing a calendar with links to upcoming trainings and conferences, and providing opportunities to connect with your peers and CVI experts via regular community of practice discussions. If you are new to CVI approaches or looking to implement new CVI strategies and have questions, please visit our webinar to complete our website to complete a TTA request form. We encourage your engagement with the CVIPI Center as your input helps prioritize CVI topics for upcoming webinars and engagements with the field, such as the ones listed on this slide. As mentioned earlier, we are recording and this webinar will be published. We'll publish the slide deck as well in the future. But for right now, I wanted to provide the links to the National CVIPI website, as well as links to the forms for requesting TTA assistance and to request to join our CVIPI community of practice. For those of you joining us live, if you're not able to scan all the QR codes, we'll put links in the chat. And for those watching the recording, feel free to engage us through the QR codes you see on the screen. During our initial webinar, we referenced the CVIPI checklist. We'll be referencing this document again throughout today's webinar. So feel free to use the QR code to access the checklist tool and follow along. There'll also be a link in the chat. Last month, we highlighted the foundations of CVI, including its definition, essential elements, and guiding principles. We'll quickly revisit that conversation as the definition helps explain why and how CVI approaches differ from traditional public safety approaches. After that quick look back, we'll move our focus to the checklist's first step, which helps inform the remainder of this webinar. Reflecting back to our February 12th webinar, we addressed how the CVI definition was created and discussed important terms highlighted in blue. Today, we're going to drill down on the specific language that delineates how CVI approaches differ from traditional safety strategies. As you see in the definition above, highlighted in blue, CVI programs engage individuals and groups to disrupt cycles of violence and retaliation, and also improve the physical conditions that drive violence. In conversations with our federal partners, they have shared how many applicants for CVIPI funding, with great intentions and passion for this work, were not clear around the specific focus of their CVIPI grant in their grant application. They shared that after reviewing applications, it was still unclear which individuals or groups were driving violence. Are they teenagers or young adults, or adults returning from incarceration? And what do we know about these individuals? Or does your community have specific places that might be driving violence? Maybe a certain business that is problematic, or an abandoned building that hasn't been touched for decades, or a park that residents are afraid of frequenting. Our goal today is to help you create a process to prioritize and define the people and places you want CVI approaches to focus on. So when you apply for CVI funding, you'll be in a much better position to be awarded critical funding resources. And this webinar isn't just for organizations and communities new to CVI. For those that have been doing this work for years, you are likely seeing opportunities for your CVI approach to grow and evolve. You could be a hospital-based violence intervention organization where efforts to engage people and families are successful in the hours and days immediately after the aftermath of victimization, but that engagement wanes after the individual is discharged and there's no connection to community partners. Or your organization might have terrific, credible messengers that have formed trusted relationships with individuals close to violence, but struggle to make connections to partners that have the resources to provide the intensive supports to not just provide them with immediate needs like job training skills, but also to address the underlying traumatic impacts violence have had in their lives. Understanding data and how to effectively use that data will help you take the next step as an organization. So again, whether you are new to CVI or an established program seeking to grow your CVI work, we encourage you to utilize the CVIPI checklist tool. Created and reviewed by CVI experts in the field, you'll see steps listed in numerical order, along with several sub-steps. However, this process is not always linear and should be thought of as having a cyclical nature. This tool, like any tool, cannot capture the unique challenges this work presents. Each community is different, and as such, your CVI approaches will not look exactly the same. But the process whereby you prioritize the challenges you want to address and the strategies you will deploy should look similar. That process begins on the left-hand side of our graphic with community engagement and a needs assessment. As your community does its needs assessment, there are many data sources to inform the direction of this work that you can see further on the left-hand side. If you are new to this work, you might be there right now. However, if you have been employing CVI approaches for some time, you understand this work is not a linear step-by-step process towards success, but rather this work, as this visual attempts to reflect, is fluid and accounts for non-linear progress and impact of this very difficult work. Ideally, your CVI partnership should be going through this cyclical process on a regular basis to assess program effectiveness, identify gaps and opportunities to evolve your approach, and create opportunities to sustain and grow your work. Let's now take a deeper look at step one. One of the most critical elements that makes CVI approaches unique is how this work is community-centered. Our panelists will talk about the role community residents and stakeholders play in Newark. And in an upcoming webinar, we'll go into greater detail to describe the CVI community input process, as highlighted above. But today, we're going to focus on step 1.2, the data collection and analysis process that helped drive down the total number of homicides in Newark from a 23-year high in 2013 to a 60-year low in 2023. We know most community violence involves a relatively small number of people as victims or perpetrators, but its effects impact entire communities. So it's critical we have the data to know who those specific individuals are. We need quantitative and qualitative data, which we'll discuss further with our panelists. But here are some questions your CVI team should be asking. And this list is not exhaustive, and this is not a one-time ask. Your team should be getting this information on a regular basis to ensure your CVI resources are being deployed to have the greatest impact at stopping violence and the root causes of violence. Having established a common foundation, let's hear from our esteemed panel. I'm very pleased to introduce the members of today's panel. Ray Chavez, Director of the High Risk Intervention for Newark Community Street Team. Mr. Chavez utilizes his lived experience of growing up in inner city and in carceral spaces to identify with others from similar backgrounds and trains them to use their lived experience and the lessons learned to intervene in the lives of others heading towards a self-destructive path. While incarcerated, Mr. Chavez set out on a path of intellectual transformation, obtaining an associate's degree of liberal arts from Mercer County Community College and a bachelor's degree in political science from Rutgers. Mr. Chavez is a credentialed researcher through CITI and has been serving his community as a public safety professional since 2019. Dr. Alejandro Jimenez Santana is an assistant professor of professional practice in the School of Criminal Justice at Rutgers University, where he serves as co-executive director of the Newark Public Safety Collaborative. His research foci are spatial analysis and analytics, social disorganization, communities, and neighborhood effects on crime. He has extensively researched the association between unique contexts of social disorganization and the effects of the immediate built environment on the spatial distribution of violence and crime across various urban settings. Dr. Santana has secured over $5 million in external funding in support of the Rutgers Newark Anchor Initiative, the Newark Public Safety Collaborative, and his contributions to the development of data-informed community engagement model has been featured in national and international press, most recently by the US DOJ. Currently, he's co-directing a multi-stakeholder initiative that seeks to improve public safety in the city of Newark through the application of an evidence-based data-informed community engagement effort. Solomon Middleton Williams is the Deputy Director of the Newark Community Street Team. He has over 15 years of experience in the health and human services and public policy fields and continues to be a strong advocate for equal housing for all. Before his appointment as Deputy Director of the Newark Community Street Team, he served as the Regional President, the Regional Resident Services Coordinator with Community Housing Partners, a housing developer specializing in affordable housing to home ownership for low-income residents. He recently founded his own company, Grace Solution Services, helping to build organizational capacity with common sense solutions. He is also on the board of directors of Elite Mentoring Collective in Providence, Rhode Island, a nonprofit built to improve the lives of young men. And Lieutenant Tremaine Phillips was born and raised in Newark and has served his community as a part of the Newark, New Jersey Police Department since 2006. He started in the 5th Precinct before serving on multiple task forces, including the Quality of Life, Gangs and Narcotics, and the Safe City Task Force. In 2016, Lieutenant Phillips became a community service officer, which set him on his current career trajectory. He was promoted to sergeant in 2019 and served as a member of the training division before being promoted to lieutenant in 2021, serving as the special assistant to the public safety director. Currently, Lieutenant Phillips is part of the command staff for the MPD, serving as an executive officer for the 5th Precinct. So let's start with Lieutenant Phillips. Take me back 10 years to 2014, when Newark was experiencing the highest number of homicides on record in the city since 1990. Neither Newark Community Street Team nor Newark Public Safety Collaborative were in existence. Please describe the impact that violence was having in the city. We might have temporarily
Hello,
lost
can you hear
Lieutenant.
me?
There we are.
There we
Do I need
go.
me to read? You got the question, Lieutenant?
Yes, yes, I heard you. I'm sorry. Excuse my tardiness. I'm at my uncle's funeral. I literally just walked away from the burial site, so I just got back in my car. I did hear the question. I would just like to start by saying that that time for us as a department was a crazy time. Well, not just the department, the city. We were just coming off a bunch of layoffs, the first officers in 2010. And that reflection in the street was a lot more pronounced than anybody I think could have imagined. It's one thing to lose those officers, it's another thing to publicize the loss, right? So not only did we know internally we would be short staffed, we also had the community knowing that there will be a lot less officers, right? So we also had the criminal element knowing that there'll be a lot less officers to respond to calls, to do investigations, and we were really short staffed. So not only did we lose those guys because we didn't have the funding, we couldn't hire. So we also couldn't bring in new officers, right? So we were stretched pretty thin, and at that time we didn't have the community resources that we needed to kind of bridge that gap. There's a lot of things that I've learned in these years since then, just having an understanding of we didn't know what we didn't know, right? We used a lot of traditional methods, informants, CIs to try to solve some of these cases, boots on the ground. But when you have a boots on the ground method and then you have less boots on the ground, it's automatically going to have an adverse effect on being able to close out cases, on being able to respond, and then that community element of people feeling that crunch that the officers are feeling. You know, we tried our best to make sure that that didn't permeate through the community, but it was an impossible endeavor. I know for a fact I was in one of those task force we spoke of. I was in a Safe City task force in 2010, and then after layoffs, I went to work midnights in the West District, which is the fourth precinct. At the time it hadn't been split like it has been now, so it was a vast area that we had to cover, and the amount of calls that we were getting inundated with less office to respond with high volume dangerous calls, which is a pretty big point. We weren't equipped to handle that in the moment. And thank you, everybody.
Thank you, Lieutenant. Thanks for being with us today. I'm going to
Definitely.
pivot to Solomon. Could you tell me a bit more about these neighborhoods where community violence persisted and what do they have in common?
Yeah, again, appreciate you, Ryan, Liz, and James for having us today to present on the efforts that's been made here in the city of Newark, New Jersey, around reducing violence and crime. Also, just want to say again, condolences to Lieutenant Phillips. As a reminder for us, he shows up for our community in the city of Newark, specifically in the fifth precinct where he is a lieutenant at, even in times of sadness and grief. And so, thank you so much, Lieutenant Phillips. Our community needs you, and we continue to support your work that you're doing. As we talk about, again, Ryan, the communities that are situated in the city of Newark, that is, unfortunately, where violence sits, it's the typical communities that we see in urban communities, which I know Dr. Alejandro will talk a little bit about, and I know Ray will also expound upon. But our communities were left 50 years of no investment in public infrastructure. And when we talk about public infrastructure, we're not so much talking about so much the buildings, right, or the highways, or the streets that we walk around. We're talking about the public infrastructure around people and building people up. After the rebellion in the 67, folks left Newark. We saw a huge what we call white flight in Newark. We saw the industrial industry, which was largely an income generating for most folks who lived in Newark. We saw all those factories disappear and leave Newark. And so that really left a lot of Newarkers, especially Black and brown Newarkers, left to figure out what was next. And unfortunately, again, over 50 years of de-investment, we saw young men turn to unfortunately street violence as a way to come together and support each other. And when we look at these neighborhoods, I love my city of Newark so much, but when we look at neighborhoods that are high in crime, we see the same thing, unfortunately. We see what we know as food deserts, right? There's typically no healthy food options for individuals. What we have is stacked bodegas or stacked corner stores that we call them here in the city of Newark. And then aligned with the corner stores, you have your Chinese store and your liquor store and your nail shop. And then unfortunately, there's other religious institutions sitting on a corner there as well. And what are we saying? We're saying that 50 years of de-investment, 50 years of bodegas and Chinese stores and things that don't really support the development of Black men, when specifically around safety, there's no options. And so we are really excited today to talk about what the change was and how it happened here in the city of Newark. But again, structural violence is faced with no support, no investment in people as we move forward. Yep.
Yeah, thank you, Solomon. Really set the stage there. So around 10 years ago, Newark Community Street Team is founded. So what are the goals of creating this organization?
Yeah, I had the pleasure, honestly, of watching our now Mayor Ras Baraka, grow in Newark as a young activist, and he often would come to my neighborhood of it's called Seth Borden Projects. Seth Borden invented patent leather, and so we had a huge patent leather industry in the city of Newark. But the mayor would often come as an activist and talk about how we would need to change public safety in the city of Newark to make it safer for Black men to engage with each other. And I saw him young. He used to come out with the huge funeral caskets and saying, hey, you don't want to do this. And so being able to see the mayor when he was young until when he was elected mayor, he had a vision really around creating a different public safety ecosystem. And he had this idea, if we're able to train residents to become vanguard safety nets within their community, we can draw and decrease violence. And we're happy to say that that vision that the mayor had still exists. And we see that violence has decreased because we decided not to invest in, again, structural investments, but to really invest in people, right? We train non-traditional workers with the assistance of Akil Bashir. Oh, let me back up real quick. When the mayor was elected, he brought in this guy named Akila Sherrills, who has done this work across the country, specifically in California. He brought him over to Newark and he asked him to do a couple of things. He said, hey, I need you to help build this organizations, put systems in place, and hand it over to the local people. And so Akila has done that. And so, yeah, seeing the transformation of the mayor, his vision, and seeing how safety is embedded in everything that the mayor tries to do, but really emphasizing working and investing in community members to reduce violence and crime. And we'll show you guys, we'll talk about that through our data points and how we collect data and what we're collecting data on. But the mayor's vision is coming to pass, right? Where we are literally reducing violence by investing in Black and brown people. And we're not doing the traditional building of infrastructure of buildings and huge parcels where we're not allowed in, where instead we're literally investing in training and residents here in the city of Newark around public safety and public health. And what we see some partners on the call today. Akil Bashir out of California with PCITI comes out twice a year and trains our team on mediation and conflict resolution. And so I just want to say thank you to Akil Bashir, to the collective, to the community-based public safety collective guiding us, NCST, on how to run the agency. Really appreciate that. And so it takes a lot to actually reduce violence, but at its core, it takes investing in people.
Beautiful. I'm going to pivot to Ray. Taking us back to 2014, 2015, Solomon described this work as new. I'm sure your team is working on a limited budget. How did you prioritize the focus of your work?
So we prioritize the focus of our work by identifying the individuals. Well, it's a two-pronged approach. We identify the individuals most in need, the individuals most traumatized, quite frankly, the individuals that we felt like, or the communities that were making the most noise. And we needed to ask these individuals, like, what the problem was. But anybody asking these individuals what the problem was or delivering the solution to these individuals just wouldn't do, because as it's been mentioned before, many individuals come into inner cities and take advantage of us. They absorb our money, absorb the culture or otherwise, and just pretty much leave individuals destitute. That's been happening with a lot of systems throughout historically. And so our approach was to identify the individuals that were making the most noise and try to approach them if they've been victimized, try to make that right, try to figure out how we can heal them from that. If they've been traumatized, obviously, see to it that the individuals receive, trauma recovery or so on and so forth. But if individuals just had this deep driving desire to seek self-actualization, but didn't really know how to do that because we were only, when there's like school career day, you may see 2 or 3 different options, and that comes in the way of law enforcement, fire department, and maybe some other organization or occupation that felt far-fetched for many individuals from the community that are suffering from food insufficiency, watching their mother or father get bust over the head or get taken away in cuffs, seeing that house burn down, and the engagement between them and these individuals come across as less personal and more about business. And so we need to have these conversations with these individuals, number one, and clear up any misconceptions that these systems don't necessarily mean you any harm in whole, in totality, that you may have had some bad encounters, but even more so, like, what can we do moving forward to bring the resources to you, so on and so forth. And so that's what we've done as an agency, tried to engage these individuals around professional development, around acknowledging their trauma, around acknowledging whether they've been victimized, and try to identify the resources that can help us along the way to mitigate those challenges that these individuals have had. And to the point of today, I'm one of those individuals that have been traumatized, that have been victimized directly or vicariously from my community, or from, the systems that were set in place to kind of like direct many individuals from my community that led us, like unfathered or single parent households, into systems, carceral spaces and otherwise. And so we sought to turn this thing around by working with individuals from that same demographic around professional development, around professional growth and otherwise. So that's what we've done. That's been our approach thus far, and it's been working. We've been able to identify these individuals and set them on a different trajectory in life by actually delivering the message that there are other options.
And so continuing, Ray, what does your caseload look like? Is it a specific number? Is it undefined? How do you define what you manage?
Well, the caseload fluctuates daily. The caseload fluctuates daily because of the community that we're in and the lack of resources and the challenges that individuals face. Each specific department could carry anywhere from between 50 and 100 people in a caseload at a time. But the caseload doesn't tell the whole story, obviously, because the resources are not always there to fully heal this individual, to fully service this individual. Sure, we may be able to help this individual if they're suffering from transportation issues, if they're food insecure, if they're housing insecure for the moment. But to be able to heal this community and to be able to serve these individuals in totality, we would actually need to put them on a work plan. They would actually need to be put, we need to help them identify their purpose by way of occupation or career. We need to help these individuals for the long term in healing their trauma and violence, because we didn't get this way overnight. There's so many individuals suffering from post-traumatic, and whether that came from their own experiences in their community or whether that's been poured into them by their parents or grandparents, whoever they have the opportunity to live with. One way or another, we carry on a tradition of traumatizing our community. And so therefore, it doesn't happen overnight. So just like a one-touch point in which your caseload just won't do. We have to hold on to our individuals, our community. We have to hold their hand. Sometimes it's a year, sometimes it's a year, sometimes it's 3 years. It all depends on the level of trauma, real or imagined, that they have absorbed and how it's playing out in their community. So as I said, in each one of the department, we'll carry maybe anywhere between 50 and 100 individuals on a caseload, sufficiently or insufficiently being able to serve those individuals on a case-by-case situation.
Yeah, and we appreciate you, Ray. And what's cool about what Ray leads, and we talk about how we reduce violence, Ryan, the message that we give to our community in order for them to receive that violence is actually being reduced, right? Because we can spit out a lot of data if we want, and it goes over people's head. But we're really clear about who drives down violence, right? The people that are driving down violence are the residents, right? They are choosing to to keep each other safe, right? NCST, the Newark Public Safety Collaborative, MPD, the city government, we are only the infrastructure that allows safety to continue, right? And so we say that to folks and they start to own safety. They identify like, hey, hold on, like I prevented this from happening, right? And that we can work together to keep safety together. And so as folks are looking into this work, making sure that we giving credit where credit is due to the most vulnerable amongst us who have the least amount of resources, but are saving lives every day with the support of organizations like the Newark Community Street Team, the Newark Public Safety Collaborators, and those in the city of Newark.
Thank you both. Yeah, such profound
Very,
points.
very important.
Yep, particularly the caseload approach. Folks often, are talking about capacity and personnel and thinking again, this is linear. And so thanks for raising that up, Ray. That this process does not just start and stop with what's on your desk. And Solomon, I think that's so profound, empowering the community to own this and to continue to build that investment in safety. I'm going to jump back to our timeline, pivot to Dr. Alex. So in 2018, the Rutgers School of Criminal Justice partners with the mayor's office and other city officials to create the Newark Public Safety Collaborative. Tell us a bit about that organization, why it was created, and for folks who may be wondering, what is someone from a university setting doing, co-leading this work?
Thank you, Ryan. I'm going to start by first thanking LISC for having me here in this important conversation, but I also want to, as my fellow panelists said, send my condolences to Lieutenant Philip. Thank you for being with us today, even though, we know you had to go to the funeral of your uncle. So
thank you so much. I appreciate that.
So why is the university involved in this? I'm going to first share the credit, even though I'm the only one speaking. Two of my colleagues were also key in helping shape what is the Public Safety Collaborative. That's Les Kennedy, who retired last year, and Joel Kaplan. And these efforts started really at the university, at the Chancellor's office, and the work of Rutgers as an anchor initiative. And could talk about anchor initiatives for quite a while, but I'm going to move it to public safety. But really, it's this idea of how the university can help the community. How can we create bridges between research and the community to find solutions that they can help improve people's lives and quality of life issues and other quality of life issues. So the collaborative started as a joint effort between, like you said, city, the mayor's office, the university, as well as the police department. And these three, these three groups were instrumental in starting this collaborative, in creating our data-informed community engagement meetings that take place every 2 months, just like NCSD hosts every 2 weeks their cell board roundtable. These conversations are driven by data. So here's is kind of what we are bringing to that conversation. We provide community organizations a platform where they can contextualize data, they can understand data, and they can understand also how to focus on certain places when it comes to different crime problems. In other words, we try to make a complex issue something that can be easier to understand and easier to address. And also, I think which is very important. Yes, the data is important because it helps us focus on the problems. It helps us take a closer look and understand what could be some of the dynamics that could be attracting crime to certain places. But it's the collaboration and the cooperation between different agencies that really is what magnifies this type, the effect of this type of program. We are in the end an intermediary organization. We depend on our community partners, and PSC is formed by over 45 different stakeholders across the city. And just to name a few, and I know I'm forgetting some, the Office of Violence Prevention at City Hall, the Brick City Peace Collective, UVSO, Lincoln Park House Cultural District, Newark Community Solutions. There's a number of nonprofits across the city of Newark that are part of the ecosystem that Solomon referred to. And really is the strength of working together and finding ways to collaborate and break silos that I think has been the success story of Newark, is really working together and finding ways where we all, from different groups, from different focuses. So we don't need to be focused necessarily on public safety to be doing public safety work, because in the end, public safety is something that we all share, is something that we all want to see improve. So we see groups that, for example, work with youth being part of this ecosystem, like MBK or NOIN, and you see other groups that focus on after-school programming being also very involved. So it's the idea is to break silos and to find ways to bring all these pieces together. So the data in the end, it just helps us to focus on the problems, but I think collaboration, cooperation, and breaking those silos is fundamental, because in the end, the police cannot do it alone, and that's something the lieutenant has mentioned. The police are limited in the end. They deal with situations where they are not equipped to deal with those problems, mental health problems, homelessness problems, other problems, domestic violence. There's all these series of problems that they are just not equipped to deal with, and they need the help of the community. How do you make that relationship, create those relationships, create the system that makes that work? How do you focus, how do you establish or develop prevention initiatives that can help deal with these problems through non-traditional community policing mechanisms?
Awesome. Thank you, Mitch. I'm going to ask you to speak a bit more about working with data. We all know how tricky data management can be and data analysis. I'm also going to, after Alex weighs in, ask Ray to complement his perspectives. We've had some rich conversations around data recently. So Dr. Alex, what are some of the things you take into account when looking?
Yes. So as you mentioned, the use of data is tricky, and it's important that we understand both the limitations, but also the potential on the use of data. So limitations, I'm going to start with the limitations, which I think are more important before we even talk about the data itself. Is most data reported by the police to the police? Not all crime is reported or ends up in an incident report. In other words, when we look at crime data, we're not looking at the totality of what is happening in the community. We don't know. We only know those crimes that have been reported. So usually the more violent crimes have better reporting than the least violent ones. So homicides are well reported, but for example, thefts are not well reported. So that's something, a limitation to keep in mind. Now, what we did at NPSC together with my colleagues was we developed this technique called data-informed community engagement. And the focus was three prongs. First, we need to democratize access to data. Data cannot stay siloed at the police department. It cannot just be a topic of conversation at Comstat meetings, which is basically the meetings the police have every Thursday here in Newark, but in many other departments across the country. So how do we make data conversations, how democratize access to these data? And how do we make sure that community organizations have access to data and analysis? So that's the number one piece. The second piece is, and it's important, is when you are looking at data, you need to be very intentional, and you need to understand the data that you're sharing with community partners. So when it comes to analysis, we look at patterns, we look at areas of concentration, and also how crime concentrates near certain places. And that's a technique developed by two of my colleagues. Risk-terrain modeling, for example, is one of the techniques that we've used to analyze and understand the collocation between places and crime. That's one piece. We also look at concentration of crime for other crime types. In the end, is using that analysis to help really bring that intel to the community. Why? Why are we doing this? We're doing this because we want to make sure that we empower these community organizations to make data-informed decisions. In the end, you can only cover so much of the neighborhood with the resources that you have. You have limited manpower, just like the police have limited manpower. And when it comes to programming and activities, we want to make sure that you are intentional about where you are going. In a meeting that I attended last year, Alexis Piquero mentioned and talked over the concentration of crime in certain neighborhoods and the importance to be intentional. Why is that? Sometimes we are too quick at saying, oh, this neighborhood has problems. Yeah, but that's too general. A neighborhood can have problems, but those problems tend to be very, very concentrated. In 5% of that neighborhood is where most of the stuff is going on. It's really that 5%. So if you have better information about where these problems are happening, and most importantly, why these problems are happening in these places, then you have a way to empower these community organizations to co-produce safety. And this really the idea of co-production, which is the third prong that I think is the most important. And I remember on the first webinar, Eddie Bocanegra referred to the co-production of safety. Co-production, I think, is key in this work because we are really moving away from community policing. Community policing tended to be too police-centric, with the police controlling the data that informs strategies, and it tended just to be a one-way street. It was the police telling the community, here are the problems, here are issues, but there wasn't really an idea of how to co-produce or how to be part of the solution. It was more of a meeting where I deliver data, and that's it. There's no backup. There's no, when co-production has to do with much more. Co-production has to do with the fact that community organizations are extremely effective, can be extremely effective, and we've seen this in Newark, at participating in community safety efforts, whether it is to reduce auto thefts, reduce aggravated assaults, or even reduce homicides, as you mentioned. Strategies can be diverse. It can be high-risk intervention, as Ray Chavez just mentioned. It can be through youth programming, where you target and look at helping youth or getting in trouble to find ways to connect them with opportunities. It is really important in this sense to tap into the non-service seeking individuals. In other words, those individuals who usually don't show up, the individuals that usually don't know those opportunities exist. How do you get them out of the of those dynamics of getting in trouble? And sometimes it's as easy as showing them that there's other ways. Someone said, if you are so smart, if you can steal a car, you have the entrepreneurship needed to maybe start a business or start thinking of other opportunities. How do you connect them with those type of opportunities? How do you think about ways to get youth out of the problem? And I think that's key. How you speak to youth, how do you make them part of the conversation? That's all co-production. It's really, how do we make this a community-led effort where different parts, different elements of the community are participating in these conversations, not just for the sake of meeting, but because the decisions, the agenda that is talked at those meetings becomes actionable. It becomes something that is going to lead to programming, is going to lead to activities, so that you can help those in need in the community to understand that there's other ways. There's ways to get out of that type of trouble. And I think the community is really, not only I think it, I know it because I've seen it in Newark, that the community can play a role in become co-producers of safety.
Thank you, Dr. Alex. A lot of powerful points there. Ray, in the lead up to this webinar, we talked a lot about traditional versus non-traditional data. We even talked about some of the deleterious impacts of the data that we look at and the assumptions we draw from that data. Do you unpack some of those ideas for us today? I think just to help balance out Dr. Alex's perspective.
Yeah, sure, Ryan. Yeah, so I understand the historical context around data, spatial sampling, all the different forms of sampling, and through probabilities and statistics and all of those different things. But as Solomon mentioned earlier, the power is in the people. Like, the power is in actually interfacing with these individuals, doing the community walks, doing the daily canvassing, facilitating and cultivating those relationships with the individuals that are out in the community, facilitating relationships with the local store business owners and otherwise, because only then can we find out the why. The why is the most important thing. All of these forms of data help and serve as a tool in identifying locations, even though sometimes historically it exacerbated the situation because data may dictate more policing in the past. Before community public safety, it would just indicate more policing would show up, and then so you get lost. You don't know whether the cart came before the horse, because individuals that use these corners or spaces as their community, because unfortunately we lack resources, and it might be a 10-family household. And I mean, it may be 10 family members living in a one apartment household, and that's problematic. So these individuals take their meetups, their commune, their relationships, so on and so forth, they take it up the street. Most often it's the corner store, because that's neutral ground. One friend lives up the street, the other friend lives around the corner, so we start meeting around here. It just there is so many different granular variables that contribute to crime, that we have to look deeper into how we think about traditional data versus actually interfacing communal data, and that's what we primarily focus on. In addition to using the data shared by Dr. Alejandro and MPSC, it is most important that we do our community walks, that we get the why from our community members. That's where we really extract the data that allows us to serve our community, because otherwise individuals are just canvassing the area, taking surveys. Some individuals come back and actually serve. Some individuals take the data and go serve themselves with it. But it's most important that all community partners are engaged in the community in a real way of a mutualistic relationship. And so when I think about data and I think about my studies and all the different forms of sampling, the convenient sampling and otherwise, I'm always skeptical because, individuals use that slogan, numbers don't lie. Well, numbers do lie, because I understand the different forms of sampling. So whenever we have individuals talking about data or otherwise, I'm always curious to how they're gathering their data, what type of sampling they're doing, and what the overall objective is. And thankfully, our community partners in Newark we all genuinely actually want to serve our community and reduce violence in our community and present a better quality of life. So we're all working hard at presenting that. But nationally, I'm not sure that that's always the case. So I can't have a general conversation, or I would not assume that we'll come up with a general consensus that everybody that is gathering data and distributing data in this way comes from a genuine place, because that's not always the case. And if that is not the case, you do more harm to our community. You do more harm to our community by delivering distorted data to individuals that have not been serving, or systems that have not been serving our community in decades or centuries or since existence. That is problematic. So we always want to be careful when we're talking about data. And so, like I said, that's why we focus on gathering data the way that we gather it. In conjunction with using the data that NPSC and Dr. Alejandro is sharing, we understand that we have to get a little bit more granular and boots on the ground and asking individuals why, because only then we can serve our community the way we need to and sufficiently.
Yeah, thank you much, Ray. Data is such a difficult dichotomy. We need it to inform the work that we do, but at the same time recognizing it doesn't tell the whole story. And I think you really perfectly painted that picture. I'm gonna pivot to Lieutenant Phillips. We ask a lot about the role of law enforcement in CVI. I think data is usually the safest answer, data sharing. Could you speak a bit about, what role law enforcement plays in CVI, or more specifically, in your collaborative spaces, and how are these collaborations supporting the goals of the police department as well, and speak to that reciprocal nature of your partnerships?
Yes, definitely. One of the things that's I believe key, and I think Alex touched on it, is you need to be in the space. And when I say in the space, I mean a relative boots on the ground mentality, right? Like, so we have regular meetings with NCST, for example, and they've been a great partner to us because it's not all smoke and mirrors. And what I mean by that is, if I know if there's a crisis going on and we're not equipped for that, and that's something that I speak about openly, right? Like any cop worth his salt will tell you they don't want to be responsible for everything, right? That's not a model that we've seen work throughout just the history of policing. I don't want to have to be a social worker and enforce law and help with parents and also do traffic and also investigate and also do relocation and also do a bunch of other things at one thing. My mom used to tell me when I was really young, restaurants have a specialty for a reason, right? Like, if I'm going to Red Lobster, I'm probably going to get seafood. That's what they specialize in. And when you have different groups that have these specialties and they're a partner to you, and when I say partner, I mean that in every sense of the word, an equal partner who's willing to come out and not only lighten the load of the officer, but also affect change for that victim or that family, man. That's something you can't really quantify with just the numbers, right? Because that effort that you're seeing is the relief that my officers have, knowing that there's an extra person that they can call to come out who's willing to come on some of these scenes. And to be completely frank, these scenes aren't always friendly. When guys from NCST come out, it isn't always the nicest environments that we're responding to, because we're talking about violent crimes. So responding to shootings, homicides, families, and mental distress. And when you have guys willing to come out there and do the work, I think it garners a different level of respect. I think in the beginning, a lot of officers didn't know what to expect, right, with the collaboration. We didn't know where that would lead. Luckily, I was in training at the time. I met Akila Sherrills. We talked vividly about what future training would look like, about what the partnership looks like. And I'm glad to still be on the front line of that. My captain, Captain Wilson, great guy, man, great captain. He was one of the people at the forefront. He used to have regular meetings with members of NCST, with OVP, to kind of figure out, again, what does this collaboration look like as far as reciprocation of information, as far as, where can we meet up, mutual training that we can take together. And what it allows me to do, which is amazing, is to be in certain spaces and get a certain credibility that I wouldn't have before. And then I think it's the same thing vice versa, right? So we're on a call every 2 weeks, and that's not a police call, right? It's not us having a call and inviting them in. It's NCST having their own call and inviting us to the space. And there's an accountability there. Like, even though we're friends, I would consider people from NCST my friends, right? My dad is a part of NCST. So there's a innate bond there, but there's also an understanding that for the work to succeed, there's accountability in both ends, right? So they have to hold us accountable as a department, because I might not be the one sitting in this seat forever. Someone will replace me at some point, and that person needs to understand how important it is to have that accountability and to have partners who are going to be at your side at every waking moment. And I think that allows a certain, I don't know how do I explain it, right? So I'll give you an example, and you let me know if this kind of quantifies a little bit better. There are certain times when I go to community meetings, right? And I go to every community meeting. That's just, I'm a former community service officer, like you stated so eloquently earlier, by nature, which kind of got me on this path. But I go to certain meetings, and I can tell you, as a law enforcement lieutenant representing the second in command at the biggest precinct in this city, that crime is down. And it will fall on deaf ears, because most people expect me to say that. They expect me to say that, yeah, things are getting better, crime is down. But now, if I can be next to Ray and be on the same call with Solomon, and now they're telling you crime is down and the city's better, that's a different connotation, right? It just is received differently by the community, because they have real stake in it, right? As far as they're concerned, the community members, they don't have to say this, right? They can say Newark Police is not doing a good job, and that'll be fine. And they can say Newark Police is not holding up their end, and that'll be fine. But when they come to you and say, yes, Newark Police was out here in the trenches with us, and this is what we're doing, and this is the results, I feel the community takes that, right? There's a difference between actual safety and what the community perceives. And if law enforcement made it as safe as possible, but people didn't feel safe, did it really matter, right? If you don't feel safe in your community, do you care that crime is down 20%? If you don't feel like you could use the local laundromat, do you really care that, robberies are down 15%? I think the fact that having that relationship and being boots on the ground in that community makes people feel safer and makes people feel attached. It makes safety feel less private and more public, right? The duty to keep the city safe is not privately mine. It's not privately the department's. It's a public issue. And when you get more public buy-in, that's when you start to realize that people feel it more, because they feel a part of something, right? No one wants to be a monolith. No one wants to be isolated. People want to be a part of something. And when you give them the opportunity to be a part of their own safety, I think it garners so much more depth to what they feel. So to say, hey, what are you doing for your community? You say, I was out there, a part of a movement. We did a block cleanup. Even our CSOs, man, I love my CSOs, Tan and Miranda, what they do here. They'll go and they'll do a block cleanup, and we'll be out there with brooms, and we'll be out there with dustpans, and we're cleaning up, and we'll have the community come out, and they feel better, right? Now, I could have DPW or sanitation come out and clean up, but it doesn't feel the same, right? When you take stake as a stakeholder in the community, and you're a part of your own safety, and you understand that that's something that we're all working towards in a collaborative effort, I think it's amazing. And I think having these partners speak on our behalf, and not just speak on our behalf, but speak about the experiences, right? Not just tell tall tales, but just be eloquent in saying this is exactly what happened. But because we're doing the right thing, I think it always hits different when someone else is telling you. I always used to say, my coach could tell me one thing, but when my teammate tells me, that's when I know I got to kick it in gear, right? That's when I know I'm really falling short. And I think that's the difference. I think having guys who are your partners, who can walk into certain rooms that just frankly, we can't walk in as law enforcement officers and have the same gravitas in that room. It just doesn't work that way. Some people just don't listen to us in the same way. Some things we just can't get done, which is why we're seeing so much better results now. Because as separate entities who work as partners, I think we cover more ground, right? There's certain things that I can do on the legal perspective that I can help out with NCSC that they don't have in that realm, and vice versa, right? There's been many times I've went to them in an open forum and said, okay, this is the problem that we have. Can we cultivate a solution together? And every single time they come back, hey, listen, we're solutions oriented. Let's work on this together. Let's go to training together. We go to trauma to trust training together and sit in the same room and have honest and open conversations between community, law enforcement, different groups. And I think that is paramount to the success of not just the groups, but NORC as a whole. I think that's why NORC is being looked at as some models across the country, just because of the work we've done, the work the mayor has kind of put in place and allowed us to do and flourish with, that I think wasn't really taking place, not to this level, within the last couple of years.
Thank you, Lieutenant. Really helps, I think, round out the picture, the power of data, the difficulty of data, but how it can inform partnership. That co-production of safety has to be lifted up. You know, putting the public in public safety has to be lifted up. I think pretty paramount points you made as well about the, you know, collaboratively identifying problems as well as collaboratively solving them.
Can I say one more quick thing? If I have a
Absolutely.
second, I'm so much time. To that specific point, I had wrote that down. I wanted to make sure I addressed that. But one of the things that we've talked about, so let's say, for example, right, and we talked about data with Alex, and we met not too long ago, and we had these conversations. Area will be targeted, and we'll say, okay, this area has an uptick in crime, right? But on the surface, nothing will have changed, right? There are no developmental issues. There is no other element that will cause crime, right? There's no commercial businesses that gets open. And what we'll be able to go in and find out via NCST is that, oh, well, you know what? Seth Boyden Projects is no longer open. And now those people have been relocated. And now those people live in what we call Pilgrim Village. And now because you have one gang group, now they're with another gang group, now there's a fight for territory between these couple of guys. And we would have no knowledge of that, right? We have no idea. We know that there's a spike, but we can't quite track why there's a spike, right? So NCST is able to go in and say, hey, this guy is the leader of this group. This guy's leader of this group. Maybe now we can forge a partnership and figure out if we could get a truce, right? That's information that people aren't going to tell me. Not in full uniform, right? I don't have the type of resources where I could just walk in and say, hey, guys, tell me what's going on, right? Nobody wants to snitch to the police, right? Nobody wants to do that. But to have a conversation with your brothers and sisters in the community, not about stopping everything, but about stopping violent crime, right? About keeping people safe in the community. That's a conversation that Ray and Solomon and other members of NCST could go in and have, and then automatically them doing the work affects us, right? Without even a relay of information, them keeping people safe automatically makes my job easier. And I think, again, that's another way that we have that synergy.
Yeah, go ahead and jump in, Ray.
Yes, I appreciate you for saying that, LT, but I just wanted to make sure that everyone is clear when we do that work, so how the partnership works, and we typically get the information from our public safety roundtable is LT will report out on CommStats. We're having issues over here, we're having issues over there. Because we have those boots on the ground and relationships, we're able to mitigate those, we're able to mediate those conflicts, we're able to intervene in those conflicts, we're able to gather the information. But I want to be very clear on one thing, that there is not a relayance of information back to the police department. And the reason why is because it is very important that we maintain our credibility in the community. Therefore, we would never be able to do the work that we do, have the conversations we need to have, or intervene in the conflicts with the conflicts that law enforcement would not be able to intervene if we did not do that. So I want to be very clear on that. I know LT expressed it, but I want to make sure that everybody here understands that in order for CVI workers to be able to do what we need to do, as what some call credible messengers, and we call ourselves community-based public safety professionals, it is very important that we maintain our credibility, not with law enforcement, but our credibility with the community. Because again, our allegiance, who we are trying to serve, is the community. That is the most important thing. So I just wanted to make sure that I highlight that, and I landed on that, so that way there's no misconception of understanding that this information goes both ways. This is how the partnership works, and it works out for everyone, because as LT said, crime is down. However it got down, crime is down. How we did it is how we did it. It's because we have a relationship with these individuals and they believe in us.
Yes, let me be very clear on that too. What I meant as far as information, they'll tell us, okay, we had this many meaningful engagements this week, right? That's the type of information I'm talking about. No specifics, no where we were, but like I said, to end my point, that's what I mean. If they're keeping people safe, that innately makes my job easier, right? That's how one hand kind of washes the other. We do what we need to do to make sure that people stay safe, and I feel like at the end of the day, that's the goal. And that credibility that they have when I'm on the public safety roundtable, that allows me to kind of be in certain spaces too when I have conversations without them, right? So someone can say, hey, if they're on the roundtable and Solomon vouches for them and Ray vouches for them, then I can have conversations with people even when they're not present, right? I can have better conversations in the community and be invited to certain community spaces that maybe I wouldn't have been invited in, right? And I think that talks about the work that we can kind of be in the same spaces doing the same work, and we can both make sure that, again, safety should be public. I think at that time safety was more private, right? It seemed like only the police wanted to hold on to antiquated ideas of, keeping people safe was the only thing that we could do, when really it's a more collaborative effort, and it should have always been like that. The ideas and opinion principles that started policing talked about the police being the community and the community being the police in the first place. And I think we're getting back around to that, and that's why we're seeing more success.
Just gonna let that resonate for a minute. I think that was a really beautiful picture of what this relationship could look like between law enforcement, how to demystify traditional data, the value of untraditional data, and hopefully we end up with better terms for that type of data. And really, I think you both eloquently articulated the boundaries of partnership and how clearly you have to communicate each other's roles in that collective. Thank you both for expanding on that. I'm gonna pivot a little bit, because we get so many questions around how we fund this work. How do we sustain funding? How do we get funding? And we often find ourselves referencing the importance of data. Solomon, could you take this first? How would you say data helps you be more competitive when going after?
Yeah, appreciate it. I just want to add and say, lieutenants and officers like Lieutenant Phillips, like we need to continue to protect them and continue to invest in them. The reality, like what makes Newark really interesting, is that we have a lot of young officers, and I mean a lot of young officers. We have folks I probably went to school with. We were probably the same age, 30 to 45 years old. And the reality is that we didn't create this mess that we're in, right? But it's also refreshing to hear individuals like Lieutenant Phillips say, hey, we didn't create it, but we need to fix it. And so that's how crime is being reduced. Also, another strategy is that literally I have folks I went to high school with who are just police officers, and their agenda is to reduce harm, and their agenda is to reduce systematic harms. And so thank you to Lieutenant Phillips and your team for having that at center of the heart. Yeah, sustaining funding is an interesting question. I don't have like a go-to answer there, Ryan, because it just varies in what population that you're in. But I would say, again, as we started this conversation, about how do we intentionally invest in people? We know that, again, CVI is about training individuals, investing in them financially, making sure that they're also feeling safe, right? But when BJA, the federal governments, are putting out federal dollars for cops, you just can't put out dollars for cops. You have to put out dollars to support the systems. So it may seem radical to folks, but it's like we need to be on even playing. If Newark police officers are getting $1.5 million to arrest people, well, we need to get $1.5 million to save people from being arrested. And we need to be on equal playing for paths financially. I would say if we had a symposium or a webinar to look at the finances saved around the work that we do, Every homicide that we prevent in the city of Newark is $8 million. It saves $8 million. And the question is, where is the $8 million going, right? It should really go right back into the hands of community. And so there are different ways that individuals can collect data when you apply for a federal grant. I'm not a TTA specialist at this moment to give grant advice, but we have to collect data. We've applied for so many grants, and at the end of the day, they come back and say, "Hey, you don't have enough data to apply for this grant to move forward." And this is why we say thank you to Alex and his team at North Public Safety Collaborative for showing us the importance of data. And this is why we as an organization have continued to advance and collect our own data from community, so that when these federal dollars are available, we can then apply for them and we can qualify for them. So the name of the game, yes, is collecting data. What the data looks like. Again, we do an outlook. We look at past grants and see what the federal government was funding. And then we try to look at that and see if we're able to collect the same data so that we're prepared for applications. Right now, it is federal season time. And so if you're interested in applying for those dollars, make sure that you have the right data and enough data to support your work. It's not a one-solve issue for us, but I also believe that if you have data, you are at a better chance to get in some of these dollars.
Go ahead and jump in, Ray.
Thank you for that, Solomon. Yes, and I will also add on, when we're talking about this data in the high-risk intervention department and whatever your respective sites call the interrupters, it's extremely important that these individuals are raised up, as Solomon just mentioned, because these individuals, like myself, we are former justice impacted, former perpetrators. Otherwise, most of us are literally going back into the old community that we were former perpetrators, and putting our lives on the line, getting spit at, potentially shot at, potentially just asking a question to try to intervene could potentially have, put you in like extreme harm. Like you can get yourself killed because you're asking about individuals' business that's not your own, and that is extremely dangerous. And but we do this work day in and day out. The team's on call 24/7 trying to get in, and so sustainability becomes a problem. If you could imagine a team operating off the salary that our staff operates off of, and to have to be on call 24/7, having one child trying to compete with this rent and trying to keep up with gas, but you're trying to engage in incidents all over the city. Why? Because you do it from your heart. But there's a conflict between your heart and your budget when you can tell your children, like, daddy is doing really good work. Are you doing this? Yes, daddy is really saving lives out here. Daddy is really stopping individuals from shooting each other, stabbing each other, beating on each other, so on and so forth. Daddy is having conversations with individuals that they were former adversarial with. But at the same time, daddy cannot afford to do all the extra things needed to be done while they're giving themselves 24/7. That is a problem. That is extremely, and it continues to be a problem with the team. The team will not abandon their post because we have buy-in for the struggle. But to be able to survive off some of the salaries that are allocated by some of the resources, it is extremely hard. And if we're talking about reducing violence, I'm going to say here, we can take ownership for that. Because I know that we've had conversations that individuals that others cannot have conversations with. And if you look at our data and you read some of our reports about some of the incidents, and you're culturally competent about how things play out in our community, that was a life or death situation. And we have so many of those. If you take a look at our impact report, if you take a look at our most recent evaluation, we have so many incidents that these individuals are responsible for mediating. However, these individuals still have to struggle to try to pay their bills, and that is completely unfair. So we want to make sure that we raise that when we're talking about this data point. Of course, this is a different point of data as opposed to identifying specific locations. We're talking about the data that is giving granular detail about the intervention and mediation that actually took place that saved individuals' lives or a group of individuals' lives when it pertains to street organizations. That's very important that we land on that, and that these individuals are sustained by doing the work. And so I just wanted to say that. Thank you.
Absolutely. I'm gonna give Dr. Alex one quick question, and we're gonna move to some of the audience's questions. I know, Dr. Alex, you've been successful with federal applications. Can you kind of speak to just some of the nuts and bolts, like what are some of the primary focuses to be successful in those applications?
Yeah, I'm going to start by piggybacking a little bit on the conversation. I think the different panelists have tapped into the important issues, the use of data and what data means and how it is. I couldn't agree more that it's something that we need to be careful, but we also need to you need to establish relationships with local researchers, with local universities to help your CVI work in this space. I think it's important that you tap into those researchers. There's researchers that may not know how to get to you. Find your local university and check if there's anyone that can help you develop some of these capacities, because I think it's extremely important and that we link some of this research with the amazing work that you guys are doing on the street, because in the end, the boots on the ground approach, as you mentioned, is what really matters. What we can do is to help. We're not trying to tell anyone. Data should not be telling what to do or should not be dictating anything. Data is just a tool in the end. Think about it as any other tool that you have at your disposal. You use it as a way to help you. But the decisions that come and the way you decide what to do or what not to do, that's where the lived experiences come in. And we should be helping bring those lived experiences that the community have to a platform where they can be used by others, and they can and in the end, those lived experiences and those conversations are what really dictates where there's programming should take place. As the lieutenant mentioned, the data may have shown an area of the city with problems, but until you go there and you check what's going on and you understand why it's happening through mechanisms that are not necessarily policing, not just sending the police, because we know already that the police, again, as I said at the beginning, the police cannot deal with all the crime problems. They are limited in their capacity to deal with some of these problems. Community, having a credible messenger be on the ground, having them have conversation with the groups that are there and understand what's happening that is driving crime to this particular area, and then be intentional. And that will repeat that again, is intentional. Be intentional about where you implement programming. If you try to implement programming across the neighborhood or you're not specific enough, it's going to be harder to make the case for your grant application. It's going to be harder for you in practical terms to actually implement programming because you have limited resources, you have limited manpower, and to be able to tap into the problem, you need to be intentional. I'm going to give you an example. We found that there was a concentration of auto thefts near a high school here in Newark. What we did is we said, okay, what's going on? What is the connection? We asked one of the community groups in the area to talk with the principal at that school, and that led to having conversations with youth from that school to understand what was going on. Why are auto thefts happening near that school? Now you're intentional. You can implement programming, community programming near a specific space, and tap into the population again that usually don't require those services. And just to wrap up about which again I've already tapped a little bit into your question, right, Ryan, is that these federal grants require a lot of work. You should read through the solicitation, go page 1 to page 20, and really take a close look at what are the things they are looking at. See if you're a good fit for that type of grant. Do you have the capacity to implement this program? Do you have the relationships in the community to implement this program? Do you have the letters of support from all the stakeholders needed? And be very, very careful at following step by step some of the questions that they are asking, some of the points they want you to tap into as you write your narrative, as you write basically the plan of your of the program they're going to implement. In our Reimagining Justice grant, we had to tap into very different community organizations, nonprofits, to know if they were going to be willing to be participating in this program, and they all came together, and we were able to write a grant application with them, which in the end has a third of the funding that we received is going directly to the communities, going directly to those community organizations that are going to be implementing programming on the ground. So very important that you pay attention to those solicitations. Be very intentional about the places, neighborhoods, areas where you want to implement programming, and make sure those relationships are established before you send that application. Taking your time and being intentional, I think, are two of my pieces of advice when applying for these grants.
Awesome. Very helpful. And thank you to all of our participants as well. The participation has been excellent, inundated with questions. I'm trying to aggregate what is most common. For Ray, we get this question a lot, and it mirrors some of the feedback we hear from our federal partners about why folks aren't getting awards. But how do you exactly determine high priority people? How do you determine specifically who, when folks are looking at wanting to work in a community and they say there's violence there, how do you focus more specifically on the exact people that are driving violence?
Well, I think it boils down to having those relationships. That's ultimately what it boils down to. We're never going to be able to get around the people. We're never going to be able to get around that interface. And there's never going to be a supplement of observing and making decisions about people without those individuals. It's most important that we have ears to the ground, boots on the ground, and that we have relationship with individuals in the community, because only in those relationships will we hear he's not the one or she's not the one. It's him who we need to facilitate that relationship with. And then when you interface and have that conversation with that individual, hey, what's up, sis? Hey, what's up, bro? What's going on? What's the situation? Just share your thoughts with me. And when they share their thoughts with you, you will either find out that there's a trail of trauma, there's a trail of victimization, or there's something unresolved going on with this individual, and then you'll know how to serve them. But you have to have that relationship. And so that's how we identify that, because we operate that if we all connect throughout this city, if everyone is connected in some way, shape, or form, whether that's my man, that's my homegirl, that's my cousin's friend, that's my sister's uncle, so on and so forth, if we're all connected in that way, it makes it very hard for anybody to do something with anybody, because everybody would be somebody. And if that's the case, if that winds up being the case, then we're able to serve our individuals because of that 3 degrees of separation in reality. And so that's how we identify the individuals. There's no one right answer to that, Ryan. I wish I could give you one simple answer to that, but it's in the details. It's in the details of your relationship with individuals from that part of the community, or in the details of your relationship with that particular individual. That's how we identify who needs the most, because unfortunately, many are following. Some individuals have different circumstances, and it would seem they all suffer from the same circumstances. But this individual may have a mother and father at home, but there may be some shortcomings. They just happen to be inspired by the rebellion of this person in this confusing time of adolescent or otherwise. And so we can intervene, cause that intervening variable, and say, hey, I give explanation to what you got going on. I understand Erickson's theory of maturation. I understand what you're going through in regards to synaptic prone and myelination or otherwise. I understand the confusing times you're living in, because you look outside and you see this thing, but inside your parents are telling you so on and so forth. And it's positive, but you can't afford to move away from what you're seeing when you walk out your stoop. And because our peers leave a big impression on us, and my peer happened to be suffering from something, then I know that I need to have a conversation, not just with this individual, I need to have a conversation with that peer that's most impressionable on this individual. So that's a small example of how we identify individuals that are most in need, or that could be most helpful with mediating conflicts in that particular area.
Thank you much. You want to add some, Dr. House?
You're on mute, Dr. Santana.
Thanks, Ray. I was going to connect it I asked that question this morning to a group of youth, and I'm going to give you the answer from the youth perspective, which I think it's quite enlightening. We said if we implement programming intentionally in areas where there's high levels of crime, or there's other problems happening in particular areas, and we start programming, how do we prevent that the typical folks, so the guys that are usually engaged that show up, are not the ones that just come there? How do we get those that usually don't show up, those that usually are not part of those circles, to show up? And I asked that question to a student, and his response, I think, was very enlightening. He said, that actually requires outreach, and it requires you going to them and inviting them intentionally to be part of it. Meaning that, again, the ones that show up are always going to show up, but they're not the ones that need this programming the most. The ones that are non-service seeking, and maybe I use that, and I know we use this term in the first webinar, is really doing the outreach and tapping into the non-service seeking ones, getting to them and saying, I want you here. I care about you. You should be in this community meeting, this community activity, this program. That is very important. And so it connects to relationships, but also connects with a bit more. It's a bit harder, of course. It's not just to call the meeting, it's also to be intentional and say, go and ask that friend that usually doesn't show up. Go ask that resident that usually doesn't show up. Get them to come, because usually the ones that need it most are the ones that just, either for one reason or another, end up not coming.
Yeah, go ahead, Ray.
Yes, in support of Dr. Santana, I'll raise that. That is the reason why I think we're contracted at roughly 20 schools throughout the city, and we hold our community walks. That's the reason why the teams are assigned to hold a post at these schools, at all these 20 schools, to identify these rambunctious youth, these youth that can use the resource. And that's also the reason why we do the community walks. So that way we can ask those questions and try to identify those individuals most in need, the individuals that we want in the room. That's why it's so important. Again, I'll keep saying this because far too often individuals have meetings or they talk around the community members, or in particular the youth. And so we want to drive that home. I know our brother Marcus Comsamos is always driving that home. Like, he is big on that out of youth build. He is big on that, making sure the youth voice is heard. And so I understand, and that resonates with me, and it resonates with the team and many of us that are doing this work.
Pivoting a bit, we got a great question from Pastor Deb. What do you suggest for tech deserts where there's a lack of access to data, when residents are often told the answers to our plight are data-driven?
Yeah, I'll jump in. Hopefully this is helpful. Similar to what we highlighted earlier, is that we just begin collecting our own data that doesn't really require a lot of tech. Literally, being able to print out, or to create a quick survey that says, hey, do you feel safe in your community? Like, what does safety mean to you? Try, or just more so multiple choice outside of open-ended as much as possible, but just trying to get as much information. We do this during our community walks, where we walk around and we gather the same like data. We don't rely on like MPD data or MPS data, because the data that the community is going to give us is going to be more granular, is going to be more intimate to actually solving crime or solving violence to a peaceful outcome, or meeting concerns to a peaceful outcome. And so literally trying to go into your own community, identifying what are some of the areas, if it's hey, why are the kids hanging outside by the bodegas? Like, going and asking some of those questions, like what are some of the resources that you need? And then taking it back and then to your team, analyzing the data and seeing what resources that you have to support the requests that your community has. The part of it is like, when we collect data, we try to make sure that we have the resources to answer the questions that the community have. And some of that stuff takes a long time. I'll give an example. We had an issue around crossing guards in the city of Newark. We had a lack of crossing guards, and this was because community members walked around and they saw that there was no crossing guards at most of the schools. And they collected data to see was a crossing guard there every day, and if they weren't, they would mark it off and say, hey, there wasn't a crossing guard. And then they would bring it, because we are the institution at NCST, they bring it to the public safety roundtable, and we're able to advocate that way to make sure there was crossing guards. Some of the stuff takes time. It has taken us 2 years to get, an identified concern from a community around crossing guard. It has taken us 2 years to fill all 80 vacancies, as we got an update this past Tuesday. But data collection doesn't require a lot of tech. It just requires some intentionality.
Right?
Yes, thank you. I'll just add on. Solomon said most of it, and it's exactly how he said. The High Risk Interventions Department does an additional community walk on, excuse the noise. They do an additional community walk on Wednesdays, and they canvass areas, like I said, that were mentioned in the Public Safety Roundtable, areas that were mentioned from MPSC or otherwise, and they typically go with a clipboard, and that clipboard is a resource board, and it's ultimately asking individuals, hey, what's going on? What's the challenge? Why are you out here? How can I help? And most of the times we find, hey, man, I just need a job. Like, we just want a job, or I need housing, or I need otherwise. They didn't bring this. And we're talking about being away from the tech desert. We're talking about some individuals that are not as familiar with tech or not as techie as many others are, but they're able to grab a clipboard, a piece of paper. They're able to take these individuals' information down, their email, their social media handle, or otherwise, come back to the office. And how do we serve them? It may not be a direct service. If there is a direct service where an individual needs therapy or otherwise, obviously the referral will be sent to them and they will complete that. But in the event that individuals need jobs or so on and so forth, we vet our resources. When I tell everybody, anywhere you go and you see they're hiring, contact the person, find out who the hiring manager is, put it in your queue. When you go out and do your community walk, you contact that individual and you share that information with these individuals. Hey, the airlines is hiring, for traffic control, IHOP is hiring, Shop Right Up the Street is hiring, and I talk to the program manager. So send your cover letter, send your resume, and let them know that I referred you from NCST. So when we're talking about redistributing the information and tech deserts being a barrier, sure, tech deserts could be barriers for some. But when we're talking about data, which is just a fancy name for information, it's just about receiving information, resources, and figuring out how you'll be able to redistribute that back to individuals. So that's what I'll say. So it's not that hard to be able to get information to the individuals that are in need of it.
Perfect. Want to round us out, Dr. Alex, and then unfortunately I will move to close out this incredible presentation.
I think it's important to look at data in different ways, and I will disagree on the point that data and information are the same, because they're not the same. So the data, when you think about data, think about those hard facts. Even though, again, I mentioned the limitations of data, of crime data, that is incomplete again. So I'm not saying that it's the only piece of data, but data and information are two separate things. So for example, when you're trying to understand what is happening in a certain area, or you're asking information, that is information. The data, when we talk about counts, or we talk about those are two different things. I want to make sure that we don't mix them on the same conversation, because they're different things. Data is one thing and information is another. So I think it's important that when we are sharing insights, or we are learning from others, we distinguish that from what the data is telling us. The data is telling me, for example, that crime is happening in these places, but I'm learning, or I'm receiving information from other sources that can help with the process, or can help describe the outcome. So let's just make sure that we don't bring the two together, because in the end, one can inform the other, and one can use the other, but they are not the same thing. And so just wanted to make that point. And I don't have anything else to add to the tech desert, so I'll let you close us out, Ryan.
Absolutely. And to Pastor Deb as well, I think looking at the value of qualitative data, which, just to complicate our discussion here, can often find a bridge between information and data. And one last thing I'd lift up as well, that I hear a lot in the auspices of my TTA work, is to think about the difference of process measures versus outcome measures, because I think formal data is often looking at outcomes, looking at numbers of homicides, and to help tell the story of your work, you could look at process measures, which quantifies the numbers of engagements, numbers of referrals, these types of things. So a 1,000 thanks to these incredibly esteemed presenters. Again, condolences, Lieutenant Phillips, and thank you for sharing your celebration of life with all of us right now. I'm going to do a few quick summary pieces here, if I can get my screen sharing real quick, just to summarize some of the stuff we've talked about. And there we are. Let's get to the slide that I need. And we will summarize how we focus on people. Okay. So I have some additional slides as well for folks that will be viewing this recording, that helps memorialize some of the great work that these two organizations are doing. And I just want to reiterate that CVI requires communities to determine a process that allows them to direct resources to the specific people and places driving community violence. So some potential process steps to consider MOUs to help define how and when data is to be collected and analyzed, by who. We had a very rich conversation in this space today. Ensure strategies and resources are engaging the appropriate people and places. Help identify those specific places where violence often occurs. Check for biases in the data that might mitigate their influence. And a plug for the work that we do, engage technical assistance partners or local research institutions that can provide support and cross-training to CVI team and staff. Moving again from the abundance of gratitude we have for these panelists joining us today and for the work that they do, and for all of you who joined us today and all the work you're doing throughout our country. If you have additional questions, please visit the National CVIPI Resource and Field Support Center. Also, at the conclusion of this presentation, you will get a short survey. Please take your time to fill that out. Both it helps us, do this work better, but it also really helps us make the case for the value of this work to our federal partners and to help bring resources to those opportunities. Thank you all for joining us today. Please look forward to more events, and we look forward to hearing from all of you. Thank you.
Thank you, and peace.